Good morning, everyone. My name is Tijani and today I'm here to discuss a critical issue impacting countless families in Texas, perinatal mental health. However, before we delve into this discussion, let us do a quick recap of how we arrived at this point. In my previous presentation, I discussed the significant challenges in maternal and child health in Texas. The state has historically struggled with high maternal mortality and morbidity rates, with a notable proportion of deaths occurring in the postpartum period, particularly between 43 days and 1 year after delivery. Rural areas in Texas also suffer from limited access to obstetric services, hospital closures, and shortages of healthcare providers, leading to what is referred to as maternity care deserts. Furthermore, perinatal mental health conditions such as postpartum depression are underreported and undertreated, especially among Medicaid patients, impacting both maternal well-being and child development. These issues underscore the urgent need for comprehensive policy intervention to improve outcomes for mothers and children across the state. I propose three policies then, which I believe will be crucial to resolving this health crisis. The first policy is to enact legislation to extend postpartum Medicaid coverage to 12 months for all eligible women in Texas. This extension will ensure continuous access to essential health care services during a critical period for maternal recovery and well-being. The second policy proposal is to establish a rural maternal health initiative. This initiative will focus on comprehensive strategies to address the unique challenges of maternal healthcare access in rural Texas by incentivizing obstetric providers to practice in rural areas, expanding telemedicine services for prenatal and postpartum care, and supporting community health worker programs. Finally, the third policy is to mandate and fund comprehensive perinatal behavioral health screenings and interventions across all prenatal and postpartum care settings. This policy will require provide funding for universal screening for perinatal mental health services, counseling, and peer support program in all prenatal and postpartum care settings in the states. Out of these three policy proposals, I strongly believe that prioritizing funding for comprehensive perinatal behavioral health screening and intervention is paramount and will receive support from healthcare clinicians and advocacy group. And that is the focus of my presentation today. So let's dive in. Mental health stands as Texas' foremost public health challenge, serving as a leading contributor to disability and death, particularly among adolescents. The prevalence of mental health conditions across the state is substantial. Annually, 1 in 5 adults in Texas experience a mental health condition, totaling over 3.3 million individuals. Now, let's talk specifically about perinatal mental health. Perinatal mental health refers to mental health conditions that can emerge during pregnancy and up to 1 year postpartum, collectively known as perinatal mood and anxiety disorder or PMADS. These conditions, such as postpartum depression and anxiety, are far more common than many realize, yet they often remain undiagnosed and untreated. The proposal is a policy to mandate and fund comprehensive perinatal behavioral health screenings and interventions across all prenatal and postpartum care settings in Texas. So why is this policy important? This policy is not just important, it is essential for the well-being of mothers and children and families across Texas. First, it is important because of the prevalence and underdiagnosed of PMADs in the state. PMADs affect approximately 1 in 7 women, but alarmingly, according to the organization Texan Care for Children, around half of all ages go undetected and undiagnosed. Not only that, data from Texas Children's Hospital also suggests significant underreporting of PMAD cases, particularly among Medicaid patients. This means thousands of mothers are silently struggling, often without the support they desperately need. Second, it is important because of the devastating consequences for mothers. Untreated PMADs can have severe impact on maternal health, including increased risk of chronic health issues, substance use, and tragically suicide, which is one of the leading causes of maternal mortality in Texas. These conditions can also lead to reduced maternal economic productivity and increased healthcare expenditures. Third, it is important because of the profound effect of child development. The impact of PMADs extends directly to the child. Untreated maternal depression can compromise the mother-child bond, leading to developmental delays, cognitive issues, and an increased risk of behavioral and emotional problems in children later in life. This can affect a child's school readiness and long-term success. Finally, it is important because of the economic burden on the healthcare system. Beyond the human cost, untreated PMADs carry a significant economic burden. A report by Texan Care for Children estimated that failure to treat maternal health conditions in Texas cost over $2.2 billion from conception through 5 years postpartum, impacting productivity, child development, and healthcare expenditure. Now let's talk about why healthcare clinicians will support this policy. Healthcare clinicians are on the front lines of maternal and child health, and this policy directly supports their ability to provide comprehensive, high-quality care. First, mandated screening provides clear, consistent guidelines for identifying PMADs, ensuring that no patient is missed due to varied individual practices. This aligns with recommendations from leading organizations like the American College of Obstetricians and Gynecologists, which advocate for routine screenings using validated tools. Second, because this policy mandates funding interventions, clinicians often express frustrations when they screen patients, but lack of the resources or referral pathway for follow-up care. Funding ensures that a positive screening leads to accessible treatments, including therapy, counseling, and peer support, closing a critical gap in the care continuum. Third, by facilitating early detection and access to treatment, clinicians will see tangible improvements in their patient mental and physical health. This leads to more positive birth outcomes, healthier mother-child relationships, and overall better family well-being, which is the goal of healthcare providers. Fourth, universal screening helps normalizes discussions about mental health during pregnancy and postpartum, reducing the stigma that often prevents women from seeking help. This creates a more open and supportive environment for both patients and provider. And finally, it enhances collaboration. This policy encourages the development of robust referral network and collaboration between obstetricians, pediatricians, mental health specialists, and community resources, fostering a more integrated system of care. So, why should this be a priority issue for advocacy and health policy development? I believe this policy should be a top priority for advocacy and health policy development in Texas for several compelling reasons. One, it addresses a leading cause of maternal mortality in the state. As mentioned, mental health conditions are a significant contributor to maternal death. Prioritizing this policy directly addresses a critical driver of the maternal mortality crisis in Texas. Two, it has long-term societal benefits. Investing in perinatal mental health is an investment in the future workforce and overall societal health. Healthy mother leads to healthy children who are more likely to thrive educationally and socially, contributing positively to the state's economy and community. Three, it is cost effective. While there are upfront costs, the long-term economic benefits of treating PMADs far outweigh the cost of inaction. Preventing severe illness, developmental delays, and long-term healthcare utilization saves billions in societal costs down the road. Four, it is an ethical imperative. This policy aligns strongly with core ethical principles. It upholds beneficence by actively promoting maternal and child well-being, non-maleficence by preventing the severe harm of untreated PMADs, and justice by ensuring equitable access to essential mental health services for all pregnant and postpartum women, particularly those in the underserved community. Five, it builds on existing momentum. Texas has already acknowledged the importance of maternal health through initiatives like the Maternal Depression Strategic Plan. This policy builds on that foundation, providing the necessary legislative and financial backing for comprehensive statewide implementation. And finally, it addresses a public health crisis. The high rates of PMADs and their profound impact constitute a public health crisis that demands immediate and comprehensive policy action. It is a fundamental responsibility of the state to protect its most vulnerable populations. In conclusion, I strongly believe the time for action is now. By mandating and funding comprehensive perinatal behavioral health screening and intervention, Texas can 1. Save lives and prevent severe maternal morbidity. 2. Improve the health and developmental outcomes for thousands of children. And 3. Reduce long-term healthcare costs. And finally, build a stronger, healthier future for all Texans. Thank you for watching, and I urge you to support this vital policy and make perinatal mental health a top priority in Texas. For references, I urge you to see my other presentations. Once again, thank you for watching, and bye for now.